A very good afternoon and welcome to this e-conference on assessing, beyond COVID-19, assessing social protection in Uganda. This is an e-conference, so we'll have quite a large number of panelists to help us navigate through what is this discussion about social protection, especially at a time like this. My name is Charles Mwangusha-Mpagi, and we're coming to you with an in-studio audience from here at the Serena International Conference Center, but also have other people will be joining us virtually to keep in line with social distancing. This discussion is brought to you by the Initiative for Social and Economic Rights in partnership with DGF and a raft of government agencies that deal with social protection, whom I'll be introducing to you shortly. We'll start with an overview to bring us to speed on what this e-conference is about, why we need to be having this discussion at the moment, why not later. We also have a keynote presentation from the Minister of State for Gender, Labour and Social Development, the Honourable Florence Nachiwala-Kiyingi. She will be joining us virtually. I understand the Minister is already with us, so she'll be joining us in a moment soon. Let me introduce the people I have here with me. I have Ms. Salima Namusobia from ISER. ISER is the Initiative for Social and Economic Rights. Very nice to have you.
Thank you, Charles.
And thank you for putting this together.
Thank you.
We'll be going into your remarks in a moment. We have, of course, like I said, we have the Honourable Minister, Florence Nachiwala-Kiyingi, who's joining us virtually. Honourable Minister, you're most welcome. We're happy to have you this afternoon.
Thank you. Thank you very much.
We are looking forward to your keynote presentation in a few minutes. I have with me in studio also Sylvia Namutebi. Muevwa. Sylvia Muevwa. Very nice to have you. Sylvia is from the Equal Opportunities Commission. You lead the Equal Opportunities Commission. Very nice to have you here. I have also Mr. Bernard Mujuni, is Commissioner Equity and Rights, but in studio this afternoon representing the Permanent Secretary of the Minister of Gender, Labour and Social Development. Very nice to have you, Mr. Mujuni.
Thank you, Charles, for having me here.
I'll introduce the other people we have here and elsewhere as we get them along. But let me start with you, Salima. Please, we have a large audience following us, so make your keynote a few remarks and bring us up to speed on why you're putting this together, why we're having this discussion now. Thank you.
Thank you very much, Charles. The Honourable Minister for Children and Youth Affairs, Honourable Nachiwala-Kiyingi. We are very glad that you're joining us virtually. My fellow panelists, all protocol observed, our participants, both on TV and social media, ladies and gentlemen, I would like to welcome you all to this e-conference under the theme Beyond COVID-19, Assessing Social Protection in Uganda, where we shall be taking stock of the existing social protection mechanisms in Uganda and examine their efficiency in terms of cushioning all affected individuals and groups from the income shocks and other vulnerabilities that may befall them from time to time. Now, social protection broadly refers to all interventions aimed at protecting individuals and groups against the risks and vulnerabilities associated with unemployment, parental and caring responsibilities, sickness and healthcare, disability, old age, housing and social exclusion. Now, according to a February 2020 World Bank economic update on Uganda, 1 in 5 Ugandans still lives in extreme poverty, and more than a third live on less than $1.90 a day. Now, following the advent of COVID-19 in March 2020, the Ministry of Finance Planning and Economic Development also did an assessment of the short-term impacts of COVID-19, and among other things, they anticipated that there will be an increase in the number of poor people by 2.6 million. Now, in 2020 alone, alongside COVID-19, Uganda has experienced emergencies such as floods, locust invasion, rising water levels on Lake Victoria, and droughts, which have serious social and economic impacts on the population and have unmasked disparities in terms of capacities of individuals and groups to be able to cope with the shocks that are resulting from these various disasters. Now, the implementation of the strict lockdown measures in response to COVID-19 increased the risks and vulnerabilities to cover people who do not ordinarily seek social protection interventions, and this resulted in demands for food assistance, access to healthcare, and access to savings under the National Social Security Fund, as we are all aware. The lockdown also disrupted traditional social protection systems like the family and clan support systems, the church groups that people always resort to, the local savings and credit schemes that people refer to as Nigina, and then also the various burial groups that people do have from time to time. But we see that social security and health insurance covers only 2% of the Ugandan population respectively, while the informal sector remains largely uncovered, and yet we've seen that the informal sector has been highly impacted by the COVID response that has happened. And the informal sector, we also know that it does covers 84%, approximately 85% of Ugandans. And therefore, that means that there is a large group of Ugandans that remain vulnerable, and that is what has necessitated this discussion to speak about the responsibility of the state in terms of providing social protection mechanisms to be able to cushion the various individuals. Now, the redistributive character of social protection plays an important role in poverty reduction and promoting social inclusion. Studies have showed that social protection systems with wide population coverage and adequate benefit levels have been effective in reducing poverty and inequality. It has also been documented that welfare policies that provide more generous transfers and better quality services are likely to improve public health and reduce health and education inequities. Social protection is therefore an indispensable part of any coordinated policy response to any crisis, because it ensures that people can effectively access health care while supporting job and income security for those most affected. It also acts as a powerful economic and social stabilizer while stimulating aggregate demand required for economic recovery in times of crisis and beyond. Uganda's Vision 2040 underscores the importance of social protection to address risks and vulnerabilities, and our third National Development Plan includes increased access to social protection among the key development strategies to be pursued between 2020 and 2025. The National Social Protection Policy 2015 is rightly themed income security and dignified lives for all, with the objectives to increase access to social security, enhance care, protection and support for vulnerable people, and strengthen the institutional framework for social protection and service delivery. Accordingly, the government of Uganda is implementing various social protection interventions, including but not limited to social security schemes like the Public Service Pension Scheme and the National Social Security Fund, as well as social protection programs to vulnerable groups, for example, the Senior Citizen Grant, which we regularly refer to as SAGE, and the Disability Grant. However, concerns remain about the scope and coverage of existing programs, their inclusiveness, and adequacy of the legal and policy framework relating to social protection. We are hoping that the discussions this afternoon will respond to the above questions, but also speak to why social protection is important and what a robust social protection system should look like, especially one that follows a human rights-based approach. The Initiative for Social and Economic Rights would like to thank the government, specifically the Ministry of Gender, Labour and Social Development, for their cooperation in enabling this conversation. And special thanks also go to the Equal Opportunities Commission, the Uganda Retirement Benefits Authority, the Makerere University School of Public Health, the Parliamentary Forum on Social Protection, and partners representing special interest groups and civil society for availing themselves to fully participate in this conversation. Lastly, but not least, I would like to thank the Democratic Governance Facility, DGF, for providing financial support for this conference. But also, I would like to thank the NTV for providing this excellent opportunity and doing a good job in terms of hosting this conference. I wish us fruitful deliberations. Thank you very much.
Thank you very much, Salima. In normal times, we would have given you a round of applause. I would have asked that we give you a round of applause, but the President advised us that the left hand is our hand. The right hand is the public hand, so don't clap hands. We'll try to stay away from that. May I now invite the Honourable Minister, the Honourable Florence Nachiwala Chiyinji, also Member of Parliament, to give us her keynote address for this conference. And then after that keynote, we will go into a panel discussion with the panelists that I've introduced and some others that I've not yet introduced. I will introduce later. Honourable Minister, the platform is yours.
Thank you very much. I thank the panelists who are here. I also thank the residents, and I thank NTV, and I thank Ugandans for one, watching NTV, two, being there to observe the SOPs under COVID. We are all going through hard times. And as a government, we are really bent on ensuring that our population is home and safe. And today we are looking at social protection, and I'm glad to know that much of it has been highlighted in the intro part. So really, I have not much that I can say, but now to go on to the point, the government of Uganda certainly recognizes that social protection is a critical prerequisite for achieving national development goals, and the need to guarantee social protection to the population and provide assistance to people who are vulnerable either by age, social class, location, gender, disability, disaster, or anybody who does not have income, or in order to promote equity across the board. So that is particularly the role of the Ministry of Gender in collaboration with other ministries, departments, and agencies. And we are proud to have the Equal Opportunities Commission, which is at the central pinnacle, ensuring that all this can be harmonized to create equality for all people. Social protection has become a major development intervention because it directly reduces poverty, supports excluded citizens to access services, provides a foundation on which to build productive livelihoods, as well as enabling citizens to live a life that is secure and dignified. Here we are looking at the young people below the age of 30, divided into the youth and the children, and then who form almost 78% of the population. In this particular regard, the children form 53%, and the youth form close to 21% of the population. So we also have people with disabilities, have the women, we have the elderly, and above all, labor, to make sure that it's all harmonized. So it aims at empowering all citizens to participate in and benefit from the social and economic transformation in the country. In 2015, as she rightly mentioned, the government of Uganda passed the National Social Protection Policy as an integral part of Uganda's Vision 2040 and promote effective coordination and implementation of the relevant social protection interventions. The social protection policy is premised on the provisions of the Constitution of the Republic of Uganda and the laws that address issues of risks and vulnerabilities, as well as regional and international instruments the country is party to. It is also consistent with other national policies and planning frameworks. The Uganda Vision 2040 underscores the importance of the social protection to address risks and vulnerabilities. Government recognizes the need to provide assistance to people who are vulnerable. As I said, they fall into age, sex, gender, location, and the disability across the board. The vision envisages a social protection system that includes a universal pension for older persons, public work schemes for vulnerable unemployed persons, and social assistance for vulnerable children. Persons with disabilities are also taken into account and the destitute in this overall policy. The vision also identifies universal health insurance as one of the key strategies for alleviating the high cost of health care by households and enhancing access to affordable health services for all. Though I have to highlight here and now that the informal sector comprises of 68%, not 84%, as earlier mentioned in the intro part of our discussion. It is far lower than that. The National Development Plan also highlights social protection as one of the key areas and strategies for transforming Uganda from a peasantry society to a modern and prosperous country. You have heard the president now and again trying to transverse all over the country slightly before COVID to highlight to the country that the mission of the NRM and the government in general is to transform the economy and the people therein from a peasantry economy to a prosperous country. And here he has always referred to people working for the stomach alone, people working for a day-to-day living, to step that up to a prosperous economy. The government is also implementing social systems meant at protecting individuals and companies across the board. The Public Service Pension Scheme, PSPS, the National Social Security Fund, NSSF, and the Parliamentary Pension Scheme to ensure that workers are guaranteed a decent life upon retirement. The core of national social protection systems is to provide regular and reliable transfers of money to all people, both direct and indirect, in social grants for vulnerable, including Uganda's Senior Citizens Grant and the Disability Grants. We also have to look at the child support grants, especially in the Office of the Vulnerable Children and the unemployment benefits. As a result, the government has been able to provide a secure platform upon which individuals can build productive and sustainable livelihoods, directly reducing employment and vulnerability, as well as supporting excluded citizens in accessing all the services. Here we looked at the Manifesto Week, where I took the country through what has been done by the Ministry of Gender. And under these assistance platforms, we acquired 85% of our targeted promises by the NRM to the country. So to speak, that empowerment of the elder people programs in Uganda has been rolled out to the rest of the country, which indicates that the income received by the beneficiaries has resulted into improved nutritional status of household members. I also have to highlight here that UNICEF made a survey, a countrywide survey in 2015, and highlighted that the first rollout of SAGE in those areas, the elder people had been able to move from 1 meal a day to 2 meals a day and to take their grandchildren to school, because they used to send the grandchildren to fetch firewood and do the household nitty-gritties as compared to going to school. So when they get the citizens grant, then they are able to sort some issues out for themselves. So contributory social security systems such as NSSF have also minimized income shocks associated with health, unemployment, and retirement. So I wish you safe deliberations. Thank you.
Thank you very much, Honorable Minister, for those remarks. Quite interesting revelations from the Minister as we get into the panel discussion of this e-conference. I need to remind our viewers from wherever you are, whether you're joining us via the live TV, which we are on from studio here, or if you're following us via the various social media platforms that we have, that we have sign language provision. Susan Mujawa is providing sign language interpretation for our people who have difficulty following the discussion as we have it in studio here. Let me introduce my panel now that is going to discuss both the remarks, the opening remarks from Salima and the keynote from the Honorable Minister. The Minister will stay with us virtually, so if we have some questions for the Minister, we also still get her to participate in this discussion. Let me introduce the people I have with me here again. Starting with Mr. Martin Nsubuga. Mr. Nsubuga is the Chief Executive Officer at the Uganda Retirement Benefits Regulatory Authority, UBRA. Mr. Nsubuga, very nice to have you.
Thank you.
I have Sylvia Muewa Ntambi, who is the Chief Executive Officer at the Uganda Equal Opportunities Commission. Very nice to have you. And like I had introduced Bernard before, let me see who else I have virtually, because I have some people, some panelists joining us, not from in studio here, who will be joining us to have this discussion with us. Let me just confirm that they are ready. Mr. Were? Mr. Were, are you with us? Yes, Mr. Were, very nice to have you. Let me just ask you to introduce yourself fully. Let me ask you to introduce yourself fully to our viewers.
Yeah, my name is Were Wataga Emmanuel Fred. I work with Uganda Reach the Aged Association. This is an aged care association which has members, older person association members, and also individual members who have a heart for older persons. I work as the head of programs here.
Thank you very much, Fred, for joining us. Do I have another panelist? Okay, so for now we'll have Fred joining us. I want to start from here and seek a very broad understanding, because right now, apart from Fred, the rest of the team that I have is government. I want to start with you, Mr. Mujuni.
Yes, please.
What is that understanding of social protection in Uganda's context?
All right, thank you so much, Charles, for the opportunity to share this with the audience. And as already laid down, the landscape already made by my Honorable Minister, the social protection which we are working on or from within in this country is catered for under the expanding, under the National Social Protection Policy. And the policy has its program and of intervention. And so it caters for everybody in this country. It provides for different avenues for resourcing the social protection infrastructure. And one of them is the social security where the NSF falls and direct income support, where SAGE supporting the vulnerable senior citizens falls, and then disability grants falls. We also have under that the social insurance and to do with the workers' compensation, you know, any other insurance that to mitigate the risk. And largely also the other aspect or pillar is social care and support. Social care and support provides for now psychosocial support. You saw people clamoring for psychosocial support. You know, we had, you know, people almost going to the extremes. Some of the countries elsewhere under this COVID were committing suicide. All that is psychosocial support. And then GBV, of course, gender-based violence and violence against children is also psychosocial support, and which falls under social care and support. And now, the other aspect is that social protection is supposed to be the process of mitigating social risks and shocks and build resilience within the community, within the society. To have an equal society is to have a harmonious coexistence. And therefore, it provides opportunities for people to tap into their potential and create wealth. That is the bare minimum in terms of social protection. Now, the other aspect is that it is supposed to provide the framework for creating other opportunities other than just mitigating risks. You see, for such a long time, this country has been investing in physical infrastructure, roads, you know, electricity and all that. And this is the time now to go into the social infrastructure. And once you build the social infrastructure, the whole game plan is done. And now the COVID response measures demand or reveal that we are into this together. You cannot say that you're not vulnerable or income secure. And also to tell you that poverty is not just lack of income. You could be having income but very vulnerable to risk. And this is what came out. I remember riding a bicycle across the hills, and I was very, very much vulnerable to any other risk. But my colleagues had never even tried to ride a bicycle on this Kampala highway. And therefore, what does that teach us? We must invest in social infrastructure, in social protection, to leverage, to make sure that people are secure. Yeah, that is important.
Just a quick question to you. That's quite a broad spectrum.
Yes.
But COVID has provided us an opportunity.
Yes,
of course,
please.
we've been talking about when the president was giving his State of the Nation address the other day,
Yes,
and I think his 15th address on COVID-19, trying to map the broader challenges that the country has faced. So COVID is one shock that comes in between March and now. Nobody has an idea for how long we'll be running with this.
Yes,
but you also have perennial floods,
oh, yes.
that have destabilized people. You have invasion of locusts. But the project that you've been running at the Ministry of Gender, which is the SAGE project, when you get out